Welcome to Qumax. Qumax stands for Quality Use of Medicines Maximised for Aboriginal and Torres Strait Islander Peoples program. The program was built to help Aboriginal and Torres Strait Islander people of any age to comply with their medication regime. Qumax exists to assist in removing the barriers for patients in the proper use of their medications. Depending on their situation, for many Aboriginal and Torres Strait Islander people, there are many factors that can inhibit them from taking their prescribed medication properly, such as financial, logistical and other concerns. Qumax commenced in 2008 and has been running successfully since then. The program is provided by the 70+ Aboriginal community-controlled health services around the country. It is also provided by community pharmacies in regional and urban Australia. In Canberra, Qumax has been running successfully for many years at the Woononga-Nimitajah Aboriginal Health Service.
Qumax is really important for the patients because it actually provides them with access to their medications.
Julie Tongs is the CEO of the Woononga-Nimitajah Aboriginal Health Service and has been working at the centre for over a decade.
Too many times people will spend their money on other necessities, and that's not being frivolous or anything like that. It's about them actually surviving, and they'll go and buy a loaf of bread or some food for the kids rather than fill their own scripts to get their medication.
Qumax is a good program because it enables the clients to understand their medicines better and to use them more effectively.
Jan Chapman is a pharmacist who works alongside Julie and her team at the Woononga Health Service. She helps in the delivery of the Qumax program at the service, and her role is funded by Qumax.
By and large, the clients in the Qumax program say that they appreciate the time that has been spent and the capacity for them to learn about and understand their medicines better. And once they get that understanding, it seems to impact on the adherence to the medication regimen, which is really helpful, particularly in chronic conditions.
Qumax was designed to assist in removing barriers for quality use of medicines. The core of Qumax revolves around 7 support categories. Let's take a look at them. The first initiative in the Qumax program is the provision of dose administration aids, or DAAs, for patients, which helps them manage their adherence to their medication dosage. DAAs are prescribed for a patient by the GP at the service, who will determine eligible patients based on the local level guidelines developed by the service to ensure priority is given to those patients that need them most. DAAs are put together by the community pharmacy and can be either picked up in the pharmacy by the client or delivered in situations where this is not an option.
It's great to know that people aren't getting their bottles out and trying to work out which tablet they have to take when, because sometimes people can get confused and might take the wrong tablet at the wrong time. So that's really, really important, the Webster packs.
Secondly, Qumax provides community pharmacy involvement and support for health services. This ensures quality use of medicine planning, protocol development and quality assurance, among other services. For participating community pharmacies, Qumax allows provision for more patient-focused and culturally appropriate services. A participating community pharmacy may also agree to facilitate additional involvement and support in areas such as QUM planning, policies, protocol development, medicine quality assurance and appropriate safety net utilisation as defined in the Qumax work plan. Local level relationships between the pharmacy and the service make it easier for Qumax patients to take their prescriptions to the participating community pharmacy and have their medicine dispensed by the pharmacist. Thirdly, Qumax provides home medicine review support, which helps reduce any cultural and logistical barriers for patients. Qumax also provides devices, which reduces the financial barrier for patients to improve delivery of medicines in cases of chronic diseases, such as asthma or diabetes.
I explain the devices and demonstrate those, and then get them to demonstrate back to me to make sure that they're using those effectively. It might be somebody with asthma who uses a puffer or several puffers, and that can be quite confusing. And administering and getting the dose in at the right time is really important as far as asthma is concerned.
Access to education about medicine and good health is also provided by the Qumax program, helping with resources and promoting suitable medication management. Importantly, Qumax assists with the training of health professionals in cultural awareness.
At Woononga we have staff who are of Aboriginal heritage and staff who aren't of Aboriginal heritage, and we're very aware of cultural values amongst the Aboriginal and Torres Strait Islander people, and we concentrate on cultural awareness. We also extend that to the local pharmacies so that they can be assisted as far as cultural awareness is concerned.
And finally, Qumax assists with transport for patients to help them get to their pharmacy services for consultations or to deliver their DAAs or medicines.
Another important part of this program is transport. Often our clients need to be picked up by a Woononga driver and brought into the clinic to see the doctor. So that's a really important service, and we've been able to expand that under the Qumax program.
Sometimes people just aren't in a position to get to the local pharmacy or to get to Woononga for an appointment, and if we can provide the transport, this is very helpful.
For patients to gain access to the program, they are assessed by their healthcare professional, such as a GP or a nurse, as to their level of risk. The healthcare professional will identify if the patient is failing to comply with their medication regime, then refer them for inclusion in the Qumax program.
At Woononga Nimityjar, what we're looking for people to benefit under the Qumax program is individuals who might be on multiple medications, people who might be on medications that need monitoring, and people who are using Webster packs, people who are having difficulty with transport and such like, so that they won't be necessarily adhering to the medication regimen we'd like to see them on.
The program is administered through the GP and the practice manager. But now when a client comes in,
can I see a doctor today?
an Aboriginal or a Torres Strait Islander person, they are automatically entitled to the Close the Gap. Those people that are on pension cards or that are at a financial disadvantage, we are able to assist them to make sure that they do get the medications that they need.
The Qumax program involves a variety of partners in delivery. It aims to achieve different outcomes for different parts of the delivery chain.
The program originated back in 2008, and it was a joint partnership between NACCHO and the Pharmacy Guild.
The current 5th Community Pharmacy Agreement funds Qumax until June 2015. The Pharmacy Guild of Australia administers the Qumax program in consultation with NACCHO and the Australian Government.
Woononga was one of the first services to participate in this program, and it's been a real value add for our clients.
For Aboriginal community-controlled health services to be involved in Qumax, the key steps are to complete an annual registration form. Then, once they have been approved and advised of their allocated budget, the service will need to develop an annual Qumax work plan, which involves distributing the annual Qumax budget and defining their local objectives for each quality use of medicine support category. The Qumax work plan is completed via the NACCHO Communication Network, or NCN. The NCN is also used by the Aboriginal Community Controlled Health Services, ACCHS, to complete annual registration and submit progress reports. The NCN also provides forums for discussion between ACCHS and the joint Qumax National Program Managers from NACCHO and the Guild. Applications may involve input from participating doctors, Aboriginal health workers and public health officers. For more information on how to participate, please contact either your NACCHO or Guild Qumax National Program Managers. For community pharmacies to participate in Qumax, they will need to liaise with their local Aboriginal Community Controlled Health Service regarding the potential to supply DAAs and other support services. Then, the pharmacy is required to complete 2 forms, the Qumax DAA Agreement form and the banking form, available at www.5cpa.com.au. These are then sent to the Guild.
Ha!